You are the FI1 doctor working with an ENT, ear, nose, and throat firm in a busy teaching hospital. You receive a phone call from a theater nurse who tells you that your registrar forgot to consent the next patient who is going to theater. You know that he is performing the operations on the list today, and your consultant is observing. She says he is currently scrubbed, and she does not want to delay the start of the next operation. You have never consented for this procedure before and have only seen it once in theater. Rank and order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. A. Ask a consultant from a different team who also performs this procedure to consent the patient. B. Ask the consultant who is in theater with the registrar to consent the patient. C. Ask the theater nurse to inform the registrar that the next patient has not been consented and tell him that he must complete it himself. D. Consent the patient, describing what you can remember of the procedure. E. Research how to consent the patient on the hospital intranet and consent him yourself. Answer: C, B, A, E, D. As your registrar will be performing the operation, it is his responsibility to discuss the procedure with the patient and obtain consent. C. You are neither trained nor qualified to consent the patient yourself, so options E and D are unsuitable. However, in this situation, you would provide more accurate information to the patient and therefore ranks higher. The consultant from your team would be your second choice, B, since, although he is not performing the procedure, he has overall responsibility for the patient. The consultant from the other team, A, would be qualified with specific knowledge of the proposed operation, but it would be inappropriate to disrupt his activities before your own consultant. You are an FI1 doctor on a neurology ward treating patients who have suffered strokes. A number of medical students have been attached to your team and are keen to practice examining patients in preparation for their final exams. Your consultant suggests that this is a good opportunity for you to practice your teaching skills. After finishing your ward jobs, you decide to offer some teaching. You have identified a patient who would be appropriate for the students to examine and have obtained consent from them. As the final group of students come to the bedside, the patient complains of being tired and dizzy and would like to go to sleep. The students seem disappointed as their colleagues have all received teaching. Rank and order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. A. Apologize to the students for the inconvenience before continuing with your other jobs. B. Ask the students to complete the examination quickly while trying not to exert the patient. C. Ask your registrar to review the patient while you teach the students with another patient. D. Assess the patient to make sure they are well and leave the bedside offering alternative teaching to the students. E. Leave the bedside and apologize to the students, arranging for them to see another patient. Answer: D, C, E, A, B. As an FI1, it is common to have medical students attached to your team. While it is part of the foundation program curriculum to develop your teaching skills, your priorities always lie with the patient. Although the patient has given consent beforehand, they always have the right to withdraw consent at any time. In this case, the patient is complaining of feeling tired and dizzy. This could be a symptom of progression in their illness or deterioration in their health. So a full assessment by you is the most appropriate course of action. D. While your registrar may need to see the patient as well, C. They will be busy with a number of other tasks and should not be disturbed before you have assessed the patient yourself. Completing the student's examination quickly, B, is entirely inappropriate because the patient has withdrawn consent to take part in teaching, and this could make them feel worse. While leaving the bedside would prevent the students from harming the patient, this would not lead to you assessing the patient. E. Option E is preferable to A. However, as this would provide the students with education and yourself with an opportunity to practice teaching. However, it would still not address the need to assess the patient, which should be your primary concern.